A Western Upper Peninsula nursing program has recently added a couple of training stations thanks to the donation from an area medical facility. The Aspirus Ontonagon recently donated 3 hospital beds to Gogebic Ontonagon ISD for its CNA vocational training program. ABC 10's Cunard Bureau reporter Lee Snitz has more.
It really takes a collaborative effort in having the supplies that we need to make sure that the students are learning on equipment that is up to date, functional.
Today's education system offers its students far more avenues for success than in past decades. And as each learning program needs room to grow, investments in education come in many forms.
There's not a lot of money to go around in education, so it's really nice when the hospital steps in and is able to provide us with some of the equipment and make it available for the students to be learning.
These students are in a CNA training program that lets them get a feel for nursing, and if they stick with it, earn certifications while still in high school.
Sometimes they come into my program thinking they're going to be a nurse, and they leave thinking I'm never going to be a nurse. And sometimes they come into my program not quite sure, and then they really find a passion.
The program maintains a mutually beneficial relationship with the Aspirus health system, and in addition to contributions like 2 more hospital beds that the students will use to provide educational treatment to mannequins Jerry, and co-ed Beatrice, many of these students will take this training right to the hospital for employment.
We've actually had quite a few of those students come here and they work as CNAs or nurses or in other departments later on in life.
Everything that we learn here, we would normally take it to a long-term facility. We have a long-term not that far from our school actually, and in April we get to go there for clinicals and practice everything we learn on the residents there.
They get real life experience taking care of patients. So they get residents assigned to them. They'll learn how to help them eat their meals with their daily cares, whatever they need for their daily life.
For some students, working with real patients is what the training has been all about.
I started as a CNA before I was a nurse, and it's a really great way to know if this is what you want to do for the rest of your life. And if you decide that's not right, then there's really nothing lost.
I already have my mindset that I'm going to become a bachelor of RN.
It's nice when they actually find what it is they want to do for the rest of their life. So it's actually an encouragement to me, and I love to see how they grow and are doing great things long after me.
I'm Lee Snitz for ABC 10 and the CW5.